Good morning, it's Dr. Jarrod Frank at PFrankMD. Welcome to my video blog. Today we're going to be talking about my favorite end of the summer topic, which is fractional resurfacing. Everyone comes in with different skin problems ranging from acne scars to sun damage, brown spots, red spots, skin tightening issues, pores, other textural issues, stretch marks. The list is long, but the answer is usually the same. We need some form of skin resurfacing to achieve our end result. Now, all skin resurfacing is not created equal. There are several devices out on the market. The most modern technique is fractional resurfacing, but we've been resurfacing the skin since the 1980s with chemical peels, and they've taken on several iterations along the way. In the 90s, lasers became popular. There were continuous wave lasers, CO2 lasers, erbium lasers, each with their own list of varying recoveries, downtime, and risk. In the last 10 to 15 years, fractional resurfacing has been developed. It's often euphemistically called Fraxel resurfacing, but Fraxel is actually a name brand. It's actually the Ferrari of lasers. They developed this technology several years ago. It's the name brand I use, but you'll see other fractional type devices out on the market. I like the name brand Fraxel mostly because they started the game of fractional resurfacing, and there are several options within the line, all four of which we have here at PFrankMD and Skin Salon. So the goal of resurfacing is very similar. How you go about doing it is what changes. There is no best resurfacing technique. Ultimately, you have to find one that is ideal for a particular patient, not only in terms of what we're treating, but also their level of expectations, their skin type in regards to safety, and also recovery and cost. These are all things that take into effect. There's always a little bit of no pain, no gain when it comes to laser resurfacing, but now with modern day fractional resurfacing, we really can pretty much treat all skin types very safely. Expectations are certainly going to change depending on what we're trying to accomplish, but it's a very safe treatment, and fractional resurfacing is really broken down into two types. We have ablative, which leaves some sort of open skin with mild recovery, and then there's non-ablative, which is the slightly lesser aggressive and most popular. And in the Fraxel range, we have four types of fractional devices. We have the Clear and Brilliant, which is kind of like the baby Fraxel, and this is a great starter treatment for younger patients or for people that are looking for more maintenance. And you could really get rid of mild sun damage and work on textural problems, pores, so forth and so on with this technology. Your downtime is really just 1 day of redness. And it's a very good user-friendly, get in the game early type of technology, often performed without even any local anesthesia. Being non-ablative, you can return to activities pretty quickly. The next level up is the Fraxel Dual, which has two different types of Fraxels in that device. You have the Fraxel Restore and the Thulium. These are really the workhorse of the Fraxel devices. They remove sun damage, both cosmetic and medical. They can reduce your chance of getting non-melanoma skin cancer. They do help with acne scars, pores, and some minor skin tightening. You're really not going to get much treatment on the deeper fine lines in the skin, and that's really where we reserve more of the ablative treatments. But depending on the caregiver, it could take anywhere from 2 to a 4 day recovery that's makeup coverable and non-ablative. So this procedure, the Fraxel Dual, whether it's the Thulium or the Restore, is performed under local anesthesia, just about an hour of topical. Any of these devices, their end result can be catered to the patient's needs. There's always a little bit of no pain, no gain, but it's important to know you're not just using an instrument, you're not buying Fraxel, you're actually buying the expertise of the provider. So it is important that you have someone skilled and certainly with the expertise in this field, and certainly someone that does quite a bit of it on a regular occasion. So you can play jazz with these devices. We often mix the Thulium and the Restore together, and we find a treatment regimen that's going to be ideal for the patient specifically. Again, there is no best laser. It's finding a treatment regimen that's ideal for the patient. And this can be done in one treatment, it can be done in 10 treatments. Ultimately, this is a discussion for you and your provider. And then finally, we have the Fraxel Repair. The Fraxel Repair is the gold standard of wrinkle treatments. It is the most aggressive, but it's still a lot quicker and safer in its recovery than older CO2 or erbium lasers. Patients are often put in twilight for this procedure, just a little nap as if they're getting a colonoscopy. And the recovery is quick and very safe, but you're at home for a week. This is reserved for patients that have a lot of fine lines around the mouth, have some loosening skin around the eyes. This is what we call laser blepharoplasty. And as someone that's really willing to commit to the type of recovery and surgical result that we can get with a home run laser resurfacing device. We really can't use this on all skin types or in all areas of the body. For that right patient, Fractional repair is really ideal and a home run for patients with severe acne scarring, severe textural abnormalities, or deeper wrinkles requiring significant tightening. It does work great on the neck. It can actually give a minor facelift type result, significant amount of tightening around the eyes. And this is something that we routinely perform. So fractional resurfacing, this is still the gold standard. It's one of the greatest type of treatments in my practice. I love doing this, and I love finding the right type of treatment and treatment course for the patient in mind. So if you want some more information about this treatment, go to my website, pfrankmd, and come into one of our healthcare providers at pfrankmd, and continue to follow us at Dr. Paul Jarrod Frank on Instagram and Facebook. Thanks so much. We'll see you soon.